Well, hello everyone. I am here with Mona today and excited to have a conversation with her about her practice and her role at Alliance Counseling Group. Let's jump in. Hi, Mona. How are you?
Hello, I'm doing fine.
Great. Well, I always like to ask when we start out, what are your credentials?
All right, I am a fully licensed master's clinical social worker.
Great. And any other certifications or anything else that you've worked on in addition to
Yeah,
that?
yes. I also have a master's in public administration.
You're bringing a few different skills to the
Yeah,
counseling room.
yes.
Love it. Well, I'm grateful to have this conversation with you. And one of the things that we like to, that I like to talk about in this setting is what it's like when a client is sitting across from you and the door is closed and we're digging into an issue. So um, if if I can ask, um, what are the kinds of conversations, the kind of approaches, um, and counseling theories, anything like that, that you really like to lean on, and so that if a client is sitting across from you, that they can count on a conversation with that kind of emphasis.
Yeah. So, one of my favorite treatment modalities to use is cognitive behavior therapy. And the reason why is because some of my favorite clients are clients that have a lot of trauma, a lot of childhood trauma that they've been through. The reason why those are my favorite clients is because I've been through a lot of childhood trauma myself. And so I feel that I can relate to those clients. I'm able to give my guidance based off personal experience, based off my professional experience due to working in child welfare for almost 20 years, and then also just based off of my educational experience. So, learning about the different things that has to do with childhood trauma.
How do you think the cognitive behavior CBT, when you're using that, how do how do you use it to sort of crack into uh, the deeper issues underneath?
Yeah. So what I like to do is just let the client tell their story and then tell how they respond to certain situations and events that occur. And then what I also try to do is kind of help them understand their feelings and how they're viewing certain events. Maybe they're viewing it in a negative way based off of their prior trauma. So I help them to kind of look at it a different way to have a better positive outlook so that they can continue to move forward and not let that childhood trauma impact them in a negative way in their present and future life.
So you're listening for a lot of historical things and how the history is sort of impacting the present.
That's correct. Yes.
Well, who is there a particular demographic? Is there a particular person that you really enjoy sitting across from and bringing this approach?
I prefer working with either teenage age or up. Um, so my main clientele, I would say, would be women who have been through a lot of childhood trauma.
What do you think? What are you drawn to in their stories, particularly women who have that um, trauma in their story?
Yeah. What I'm drawn to is just understanding some of those impacts that they're currently going through. A lot of times they may suffer anxiety or depression as a result of their past traumas. A lot of times they have relationships they're in that are negatively impacted, based off of their past traumas. So those sort of things pull me in that I can kind of help them to understand it a little bit differently, move a little differently, and act a little bit differently.
So it may not necessarily be one particular I get stuck here. In your conversations, you're hitting a bunch of issues.
Yeah, that's correct. Because we have to understand that, some people have a lot of childhood trauma, But then also we have women who go through a lot of relationship trauma. So I'm kind of talking to these women about all those various aspects of their life to kind of provide them the proper guidance so they can have a more positive outlook.
What do you think when you get feedback from clients? What do what do you what do you hear? What's um, clients? What kind of feedback do clients often say about you?
They often say to me they can't understand how I understand their feelings or what they're going through. And and I always have to let them know, I've been through some things myself, so I understand. And so I think because of what I've been through and with my advice that I give them and the guidance I give them, it really resonates with them. And so they really appreciate that. And it seems to help them. That's what I've been told. So
I like it that they connect with you because you've connected well with them.
that's correct. Yeah. They feel that they almost feel, I've heard some clients say, "You're reading my mind." And I'm like, "No, I'm not." But I just understand, a lot of what they've been through, and I understand the feelings that they have. And I also understand why they may react to certain things in the present time based off what they've been through in the past. So I just kind of try to help them to change that outlook, move a little bit differently in a positive direction.
I love it. That's one of the things that I feel like I've had a really good day when somebody when I either can sort of finish their sentence or sort of give them a reframe like and they say that's it. That's exactly it. That
Mhm.
will you be able to connect like that. So you saying that I love it.
Yeah. Yeah.
Uh, and you're pretty familiar with the telehealth platform. You meet a lot of clients virtually.
Yes, that's correct. Yep.
What do you think? Uh, Sometimes people will talk about how the telehealth platform may not be as personal, or there might not be a good of connection. How do you sort of overcome some of the limits of the telehealth platform?
Mm, Well, I haven't had any problems with my clients as far as seeing them through telehealth. A lot of them find it to be a little bit more convenient because of their busy schedules. So I haven't had any issues or concerns with seeing any of my clients via telehealth.
Great. How do you know, Mona, when you've done uh, a good job and your client is moving in a good direction?
Well, I know I've done a good job when we run out of things to talk about. That's number one. And then number two, a lot of the concerns that they had when they first met with me, they've now learned how to address those concerns in a positive manner. And I learned that I'm no longer needed for that client. And so that's how I know I've done a good job.
Love it. Well, I am really glad that you are at Alliance and
Mhm.
um, that you are available, that people can reach out and get connected with you, and they can know um, somebody who can care about them and can connect with them. So, thank you for taking this time talking with me and for the work that you do.
Well, thank you. I really enjoyed this. Thank you. I appreciate it.